As we step in the era of Sustainable Development Goals post-2015, sustainability takes center stage. Now, sustainability comes from truly understanding the root cause of ill health. For example, TB. We used to think of TB simply as an infectious disease of the lungs. However, TB is transmitted through air, which means anyone can be infected. But people who contract TB usually have poor nutrition, and people who often have poor nutrition are poor. So the root cause of TB is poverty. And if we aspire to reach sustainability in its prevention, it's important to recognize the social and economic determinants of this disease. This concept of looking at non-health determinants of ill health is nothing new. Public health professionals and international health organizations have been focusing on this for decades. Also in place are foreign aids focusing on poverty elimination in lower-income countries. However, the ever-increasing global spread of HIV and malaria, the SARS and avian influenza scares, the recent Ebola outbreak, and now the emergence of superbugs has all brought into light new factors that are coming into play, which was not there before. With globalization, we are dealing with new health challenges. What we have to realize is that it's impossible for individual countries to tackle these threats alone, and we have to look beyond traditional approaches. Instead of emphasizing control of a specific disease in a particular population, we now need to think of health as this global all-inclusive issue, which means we must look for health solutions that cross boundaries. And that is exactly what we're trying to do at CEREBRO. Look for sustainable solutions for some of the most pressing health challenges of our time by emphasizing on global health research and practice. Low-income countries like Nepal contribute to more than 50% of global disease burden, and a substantial portion of these diseases are preventable. Controlling them requires good interventions, and good interventions require good research. At CEREBRO, we aim to bolster research capacity in Nepal. If we can get the science right and generate accurate evidence locally, we can share this with the larger global community to build better healthcare interventions around the world. We also recognize that to come up with sustainable solutions, we need a novel approach to research. And that's why we embrace the concept of One Health, realizing the interconnectivity of all life systems in Earth. One Health is an approach to tackle diseases by considering all components that might lead to or increase the threat of disease. When we combine global health and One Health, it becomes important for every one of us to be aware of our impacts on every life system on Earth and come together to solve the root causes of ill health. CEREBRO has been quite successful at implementing this approach by fostering intersectoral and transnational collaborations to create this dynamic team of professionals from all walks of life. Most of our work require the use of cutting-edge technologies in the fields of genetics, bioinformatics, and artificial intelligence. We're using some of the most groundbreaking approaches in science to solve some of the most neglected health problems in the world. We're embracing concepts in population health that has never been tried before in the country, and we are maximizing their effects through creative thinking and scientific progress. The result is this framework of innovative, bold, and dynamic practice to create a better world. At CEREBRO, we are committed to achieve sustainable and equitable health for humans, animals, and the environment nationally and globally through research, education, and global partnership.